Hi guys, welcome to my YouTube channel. Myself Ravi, I am your mentor and guider. Okay, today we will discuss an important topic regarding the many competitive examinations. This topic asked many times in the examinations, that is surgical safety checklist. We will discuss in details regarding the surgical safety checklist, what all are the benefits of this surgical safety checklist and that aims and objectives of this surgical safety checklist. First thing is, what is surgical safety checklist? The surgical safety checklist, it is a checklist for WHO developed by the surgical safety checklist, and this main aim of the surgical safety checklist is for patient safety or to provide a patient safety and to improve the communication between the surgical team and to maintain a proper teamwork. Then what all are the objectives of this surgical safety checklist? The first objective of the surgical safety checklist is to avoid the avoidable surgical harms or to prevent the harms which are occur during the time of an surgery. Then ensure the critical safety steps. To ensure critical safety steps during the time of a surgery. It means during the time of a surgery, each steps should be followed by one. Then next one is to promote the surgery teamwork, and next one to maintain a proper or a good communication between the surgical team and patient good outcomes. These all are the main outcomes of the surgical safety checklist. Then now we will discuss the important aspect of this surgical safety checklist. Many times questions asked from these phases were also called as steps followed in the surgical safety checklist or main phases which are followed in the surgical safety checklist. The first phase is sign in, second one time out, and third one is the sign out. Usually we will think sign in and sign out is there, but there is no time in. Why it is like that? Here time out means once the patient preparation is completed. Timeout means once the patient preparation is completed, then all team members should ready for the surgery. That's what here timeout indicates. Okay, we will discuss one by one in details. The first one is the sign in. It should be done before the induction of an anesthesia with at least one nurse and anesthetist. What are the things included in this sign-in process? The first important thing is nurse has to confirm whether the patient is confirmed his or her identity, site, procedure as well as the consent. The nurse should confirm whether the patient is obeying or whether the patient is ready for the surgery, as well as whether the patient knows particular procedure which the patient is undergoing. That should be confirmed, and where the site is marked, as well as the what procedure the patient is undergoing, he should know or not. That's a nurse has to confirm. The next thing is the anesthesia machine and medication check complete? Here first we should ask the anesthetist whether the anesthesia machine is working or not, and required anesthesia medications are available or not. We have to confirm with the anesthetist. Next thing is the pulse oximeter on the patient is functioning or not. We have to observe whether the patient pulse oximeter is working or not. The next thing is, does the patient have known allergies? We have to ask to the anesthetist whether the patient is having any known allergies, because during the time of operations we are using some medications or some tissues or some implants. Some patients or some individuals are having allergic reaction to the particular drugs or a particular foreign bodies. that one we should confirm. Then next thing is the difficulty airway and risk of aspiration. We have to ask the anesthetist regarding the patient condition, that is difficulty in airway and aspiration risk. This difficulty airway occurs during the time of a particular diseases like any respiratory disorders, or due to the surgical procedure there is a chance of an aspiration. That one we should ask. If the anesthetist says yes, the patient is having difficulty airway as well as the aspiration risk, in that condition we have to confirm whether the required equipments are available or not to overcome that risk of aspiration as well as the difficulty airway. Here next thing is in sign-in process, that is risk of more than 500 blood loss. This one with more than 500 blood loss, that is we are normally asking in adult and more than 7 ml per kg in children. If the doctor says or if the anesthetist says the patient is having risk of blood loss more than 500 ml, means we have to arrange the infusion or a blood transfusion. We have to arrange blood transfusions. Next process of this surgical safety checklist is, that is second phase, that is timeout. As we discussed, timeout means all patient preparation should be completed, then all team members should ready for the surgery. That's what we are going to call as timeout procedure. When we have to do this timeout, that is exact before the skin incision, after completion of all patient draping and side cleaning, everything, before making a skin incision we have to make a timeout. Okay, what are the things included in this timeout? First thing is, all surgical team members have introduced themselves by name and role. Here important thing is, each surgical team member should introduce themselves by their role as well as name. Okay, for example, if doctor is there, the doctor tells I am doctor so and so. My role is in this surgery, my role is I am main physician or a main surgeon. Next, anesthetist, what is his role, as well as nursing officers. Here next one is confirm the patient name, procedure and where the incision will be made. Here important thing is, the doctor has to confirm before making an incision, he has to confirm what is the name of the patient and procedure and where he is doing the incision. He has to confirm. The next thing is, has antibiotic prophylaxis has been given within last 60 minutes. The nursing officers who all are going for timeout procedure, that time they should ask the anesthetist if whether they are given antibiotic prior to the surgery, that is at least last 60 minutes. We have to confirm because we have to avoid the infection. That's why we are giving antibiotics before 60 minutes of the surgery. That is what we are going to call as prophylactic antibiotics. Next thing is anticipated critical events. We have to ask, or the surgical team has to confirm, what are the anticipated critical events which occurs during this time of this surgery. The first we have to confirm with the doctors, or first we have to ask to the doctors what are the critical or non-routine steps. We have to ask if any critical steps are following during this surgery, then how you are overcome that critical steps. We have to ask. Then next thing is, how long this case will take. Based upon this duration of surgery, we can plan for a patient care. That's we are going to call as how long this case will take and what is the anticipated blood loss. As we discussed in the sign-in process, if the anticipated blood loss is more than 500 ml, means we have to arrange for a blood transfusion. Next thing is to anesthetist. We have to confirm any anticipated critical events are there or not. We have to ask whether their patient is having any specific concern. Here specific concern means if the patient is having hypertension, or if the patient is having diabetes, or if the patient is having any respiratory disorders, or if the patient is having risk of aspiration, or if the patient is having any blood related disorders. In that time we have to ask, prior to the skin incision, we have to ask the anesthetist, are there any specific concern or there or not. Next thing is to the nursing team. Here important thing is the maintenance of the sterility, or that is maintenance of a sterile technique. We have to ask whether the sterile technique are maintained or not, and we have to ask the nursing officers, are there any equipment issue or concern. Before making an incision, we have to ask whether there is any equipment problems or issues are there, means they have to report it. Then last thing in this timeout is, that is essential imaging is displayed or not. If it's applicable means we have to tell it's applicable, or it's not applicable means we have to tell it's not applicable. What do you mean by that essential image is displayed or not? It means during the time of a surgery, in some orthopedic cases or in any general surgery cases, the doctors or surgeons tells us to display a X-ray films or CT scan, MRI films on the digital board. That's we are going to call as a essential imaging displaying. Okay, the next thing is the last step, or the last page of the surgical safety checklist is, that is sign out. As we know that sign out means coming out from the room or coming out from the operation theater. What we have to confirm, or what are the things we need to check before the sending patient out from the operation room. The first, nurse or a nursing officer verbally confirms the name of the procedure with the doctors. Before leaving the operation room, the nurse confirms the name of the procedure. The next thing is, the nurse has to confirm with the scrub nursing officer as well as the doctors regarding the completion of instruments, sponge, needle counts. We have to confirm to prevent the complications. For example, if there is any sponge or needles or any instruments kept inside the wound or inside the body, it may cause many complications like sepsis, or sometimes it may cause the even death also. To avoid those complications, we have to confirm all instruments count are correct. Then next thing is specimen labeling. In some cases, the doctors are sending the specimens like tissues or a culture or fluids for a culture and bacteriological studies. They are sending the specimens. We have to ask the doctors name of the specimen, what is the name of the specimen, and which investigation we have to send for this specimen. Here next thing is whether there are any equipment problem to be addressed. Here also we have to ask the surgical team for any equipment issue or addressed during the time of a surgery. The next thing is to surgeon, anesthetist and nurse, we have to ask what are the key concerns for recovery and management of the patient. Here it includes, the surgical team says what are the things we have to implement after the surgery once the patient shifted to post anesthetic care unit. In that unit, what are the things we have to implement to easy and healthy recovery of the patient. For example, there may be a changes in the fluids, or there may be a changes in the body positions, as well as there may be changes in the diet, medications, and or some other specific concerns they will advise for the early recovery of the patient. This is regarding the sign of procedure. Okay, we can see here the World Health Organization given a surgical safety checklist. In all Indian government and even the state government hospitals, they are maintaining this surgical safety checklist. As we discussed all these things, here we can see before induction of anesthesia, that's what we are going to call as sign in. Then before skin incision, we are going to call as a time out, and before patient leaves the operating room, that is we are going to call as a sign out. Here each steps what all comes under each phases we have discussed in details. Last thing is conclusion. This surgical checklist saves lives and improves communication and efficiency in the surgical team, and it must be followed every surgery. One slogan we can say about this surgical safety checklist is safe surgery always saves lives. The safe surgery always saves lives, which was given by the World Health Organization. Okay, up to this we have discussed an important topic regarding the surgical safety checklist. I hope you all are understand regarding this topic. If you are having any doubts or any questions, you can ask in the comment box. Thank you.